Thanks, Senator.
Appreciate that, Mr. Chair. Thank each of you. I want to make sure to thank each of you for spending your time here, but all the work you're doing. I want to start talking a little bit just about the recent so-called One Big Beautiful Bill and its cuts to what are going to translate into major costs and a dramatic drop in coverage. Senator Sanders isn't here, but I am a firm believer that we should be able to get everyone health care coverage. And how that we get there is hotly debated. I'm a big believer in community health centers. But if you take away Medicaid or dramatically cut it, that's a primary source of revenue for so many of those institutions. I want to go into, since we are limited in time, I want to go into the transparency issue because I think this is critical. Almost everything we've discussed, if we had a fully transparent system, whether you're talking about pharmaceutical costs or PBMs, their share of this or that, a transparent system allows us to begin to assess that, and especially, as several of you have mentioned, allows businesses that are actually paying for the insurance for their members to really see what's going on and address how to correct it. And that market there is important. I'm with Senator Marshall on the Patients Deserve Price Tags Act because I think it's the first step. It's not all we need to do. I mean, I started working with community health centers 50 years ago. Actually, I tease Senator Sanders because I was in print in a letter to the editor of the Middletown Press saying that healthcare should be a right and not a privilege in 1978, which I think is about 10 years before he was first in press saying that. But beyond that, what can we do now? And the transparency is a big deal. So, Ms. Deacon, Mr. Miller, Mr. Ippolito, do you think that bills like Patients Deserve Price Tags Act really will help further expand transparency and assuming that it does, bring down costs? Let's start with Ms. Deacon.
Thank you. I absolutely believe that the bill, Patients Deserve Price Tags, can be just a monumental shift as far as transparency on hospital pricing, expanding hospital price transparency, but especially for somebody that's focused in the employer space, it can be transformational. It will be transformational for employers and their ability to actually exert the market power that they should have to lower costs.
Mr. Miller? Or Dr. Miller, I'm sorry.
Absolutely. And I would say it is unethical for us not to have price transparency. So it is a must-do.
Great. Mr. Ippolito?
Yep, I agree. And I'll just highlight that it also helps us when we think about evaluating how these markets work and designing policy. Better information helps us.
And I'll go down the whole list. Dr. Gaffney?
Price transparency, I think, would be fine. It wouldn't do anything for the 15 million people who are going to become uninsured in the coming years, the 27 million who are currently uninsured, or people with very high deductibles. But I think it's useful.
Fair enough. Mr. Potter?
I think it would be very helpful. I think it should actually be broadened to include transparency about transactions like buying big clinics and things like that. So there's a lot of need for transparency across the board. And I do think employers should be able to get their claims data. Some employers have had to sue their carriers, and not necessarily very successfully because of current law. So it's very important.
Absolutely. And again, I think we look at all the different places where the lack of transparency gets in the way of value, the assessment of value, and you know, again, once you have transparency, you can move towards better quality and measuring quality. That's got to be part of this as well. Mr. Potter, since you're talking, your testimony mentions the rising costs of medical debt in this country. And I think that should alarm all of us. Greatly concerns me. You think the increased pricing transparency requirements for hospitals and insurance agencies in our bill, as well as the PBM reforms that our committee's worked on, other things, do you think that will reduce the amount of medical debt that patients are faced with if we get these things done?
It should. The Affordable Care Act allows families to be on the hook for getting close to $20,000 a year in out-of-pocket expenses. That needs to be addressed. But yes, transparency, reducing a lot of or more transparency into the list price of things, as it was noted. People often have to pay out-of-pockets based on a high list price. So transparency ought to be helpful here. It should.
Great. Well, I appreciate that, and I appreciate, again, all of your work on this. And I'm certainly want to make clear that I do believe everyone should be able to go to the doctor, have a medical home that they go to. And I think the cuts that were recently passed in the reconciliation package are disastrous. And that by cutting Medicaid so much and getting rid of so many of the subsidies from the Affordable Care Act, we are going to deprive many, many millions of people from the coverage they deserve as Americans and as human beings. I yield the floor back to the chair.